Thank you so much, everyone, for joining us this evening, and I would like to welcome you again to our talk today. So our topic today is zoonotic diseases, connecting dots between human and animals diseases. So to me, when I hear the word zoonotic disease, what comes into my mind first is rabies. Because back into my home district, I have witnessed a child, our neighbor's daughter, die due to rabies. So this child was bitten by a dog, but then the parents didn't know how dangerous rabies is. And by that time, I was also just a teacher and I had very minimal knowledge on rabies. So the child was not taken to the hospital. We all thought that, it's a small wound and it will heal. And of course, yes, it healed. She was healthy. She would come to our house to play with my little cousin. And then just after 7 to 8 months, she was sick. She started showing signs like those of a rabid dog. She would bark and she became so aggressive and salivating all the time. Her parents rushed her to the hospital, but then it was too late. The doctors could not do anything. And then she passed on just like that. We lost her. So when I went to the university to study veterinary medicine, it all started making sense to me. And public health became one of my favorite courses. So today I'm very excited that we have speakers, those that are experts in One Health, those that are doing a lot on the ground to try to prevent diseases. I mean, deaths like my neighbor's daughter. So we have Dr. Fausta Dutuze, who is a veterinarian from Rwanda. She is specified in public health, and she is a lecturer and a curriculum thread coordinator at Rwanda Institute for Conservation Agriculture, RICA. And we also have Dr. Gilson Njunga, who is a veterinarian from Malawi. He was the deputy director for animal health department, and after retiring, he does part-time lecturing at Lilongwe University of Agriculture and Natural Resources, where I was trained, and he also does some consultancy work on One Health and mostly on antimicrobial resistance and zoonotic diseases. So I'm so glad they're with us today. And we are going to start with a presentation by Dr. Fausta, who is going to explain what zoonotic diseases are, what the One Healthy approach is. So ladies and gentlemen, please help me welcome Dr. Fausta on the stage. Dr. Fausta, the stage is yours.
Thank you so much, Stella, and thank you so much, Johan. It is my pleasure to be here tonight. I'm here to share a little that I know and learn from others. So, as Stella mentioned, I work at RICA as a One Health coordinator and senior lecturer, and I'm going to give a very brief overview of One Health and zoonotic diseases in Africa. So, before we go into the definition of One Health, let's reflect on the definition of health itself by WHO, World Health Organization. So the WHO defines health as a complete state of well-being that includes physical well-being, social well-being, and mental well-being. So sometimes we think we're healthy because we're not sick. I remember when I gave this definition to my student, one of them said, if this is the definition of health, none of us is healthy. So then now what is One Health from the definition of health? So One Health, before I define One Health, I try first to to imagine a person. This person is random, can be me, it can be you, it can be someone else. And I think of all the factors that can influence the health of this person. So this person's health can be influenced by the parents. As you know, some diseases are genetic. It can also be influenced by where he is, the geography. So if maybe you live in a valley close to a lake, you might be more prone to have mosquito-borne diseases like malaria or others. You can also the politics of where you live can also have an influence on your health. Let's say you live in a country, like for example, in Rwanda, you have a policy about mandatory vaccination of children from day 1 to 15 months. So that has helped a lot in the reduction of prevention of disease, in the reduction of prevalences of disease like TB, measles, rubella, polio, and others. So culture and beliefs. Some cultures and beliefs are directly linked to nutrition. Or let's reflect on the case of Ebola. There were some cases of infection because family members would take care of their family members who have died from Ebola. Education has a very big influence on health, national security. If the country has wars, the health services will be affected. That stuff will have an impact on health. Economy, this comes in terms of infrastructures and yeah, interaction with animals. If you have a pet, if you visited a park, if you live close to a protected area, or maybe what could have been a park but it does not have a fence, that will have an impact on your health. Diplomacy. So where like the relationships between your country and the others, let's say, especially in terms of trade, if for example, like in Rwanda, but we buy a lot of things from Uganda, so we're going to have a change of diseases if we don't pay attention. And what I do, so if you're an agriculturist, you're going to have diseases that are related to agriculture. Let's say, for example, the intoxication of pesticide and many other factors. So you can see that health itself is complex, but One Health, what is One Health now? So One Health by definition is a recognition that our health, human health, is very closely linked to the animal health and the ecosystem health, the environment where we live in. Now, why is this important? So from different factors that influence health that you have seen, you can tell that it is impossible to address the health issues being one institution, for example. There is need for a collaboration. So the One Health, One Health will lead to collaboration in a way which is really mandatory. So now, one of the biggest problem of One Health, although this is not the only one, because apart from zoonotic disease, you also have different things like antibiotic resistance. We talk about them. You have intoxication. But zoonotic disease represent a very important part of One Health issues. So maybe some of the people in the audience know what are the zoonotic diseases, but zoonotic diseases are diseases that are transmitted from animals to humans. So in Africa, we have many of those. The most prevalent ones are Rift Valley fever, rabies, as Sela said from her introduction. We have brucellosis, we have anthrax, and Dr. Njunga will talk about anthrax. And also have highly pathogenic avian influenza. We also have diseases which are not zoonotic per se, but they come from a zoonotic origin, like Ebola, HIV, COVID-19, and Marburg, and others. These, I'm sure you have heard one or two story about this in Africa. So now, what are the factors that are coming into the high prevalence of these diseases? The first one is the lack of robust surveillance systems. So some of these diseases, they are very contagious. They need high containment facilities, and those are not really, I mean, we don't have them in Africa. We're lacking of laboratory facilities. We also have high population growth. I think Africa has the highest population growth among all the continents, and that's going to increase the density and the susceptibility itself. And then the rapid urbanization, of course, the population growth will also be linked to the rapid urbanization. Although the urbanization is good, it's going to come with a disturbance of ecosystem, which is going to be linked with maybe the disturbance of the ecosystems of the reservoirs, which can increase the likelihood of having zoonotic diseases. Also, the human movements. We all know the saying that the world now is becoming a village. So we are moving a lot. That's, of course, it's coming with benefits, but it's coming also with the issues of health. So yeah, that's it about my introduction. As I think this session is interactive, and I'm here to maybe to answer some questions at the end of the presentation. Thank you.
Thank you so much, Dr. Fausta, for the lovely introduction to zoonotic diseases and what One Health is. I love the way you have done it, the way you have touched the factors that influence health. And yeah, I love the way you've said that involvement takes part. So yeah, as we all know, we are now talking of like climate change, that there is climate change that has happened. So I just want maybe to our two speakers to explain more. How has climate change affected the spread of, how is it affecting the spread of the zoonotic diseases? Maybe if we can start with you, Dr. Njunga. What's your say on that? Okay. How has climate change affect the zoonotic diseases?
Thank you so much, Sarah. First of all, the effects of climate change, do come in different ways. One of the ways is, coming with maybe, excessive rains, all right, or dry spells. Those are some of the, issues that come, with climate change. So, for example, when there is, excessive rains, that rains will either bring in, certain vectors. In other words, it will come with, proliferation of certain vectors. And those vectors, majority of them, they are responsible for transmitting the zoonotic diseases from animals to humans. Good examples are what Dr. Fausta said. She talked about, Rift Valley fever. It's one of the, common vectors that is transmitted by, insects. Also malaria, right? It's mosquito transmitted. Those are some of the vectors. And when there is too much rain, there is too much water, and those mosquitoes or those other insects, they breed wherever there is a lot of water, and they all come because of this climate change. On the other side, again, you could have a lot of dry spells, right? So when there is dry spell, now there is an increase of interfacing between, say, animals, say for example wildlife and domestic animals. There is some interface, maybe looking for water, because water becomes scarce. So these animals, whenever they are interfacing, they are transmitting diseases between the wildlife and the domestic animals. Now, being domestic animals, we live with these animals either within our home state or in certain African setups. Actually, people live together with the animals in the same house. And because of that, then you end up, transmitting some of these, diseases. I can just give those, then maybe, because of time, Dr. Fausta, can come in with others. I've just talked about excess rains, the effects, as also effects of dry spell with respect to, exploration of insect vectors. Thank you.
Thank you so much, Dr. Njunga. I'll come back to you with another question, but now we should go to Dr. Fausta. Dr. Fausta, do you have anything to add on how climate change is affecting the spread of zoonotic diseases in your perspective, maybe in Rwanda?
Yes, so I will add the context of Rwanda because I think Dr. Njunga had said really perfectly. So the climate change comes with changes in temperatures, extreme weather events, and like floods, droughts, storms, and change in precipitations. In Rwanda, we have seen this by the change in the Rift Valley fever transmission dynamics. So the rainy season in Rwanda, for example, is known to start by end of March and continue by April. But now the rainy season is becoming not predictable. Like it's even extending to May, and sometimes you will have even the dry season is no longer what it used to be. So you can tell that the duration period where we knew that this is the period of Rift Valley fever is no longer the same. So this itself is an evidence. So in Rwanda also we had in March, on March 1st to March 3rd, we had very unprecedented floods that killed more than 100 people. So this is materialization of climate change. And that, of course, came in with high prevalence of waterborne diseases. Thank you.
Thank you so much. But before I continue with the questions to the audience, please feel free to write your comments, your questions in the chat. At the end, we're going to read those and our experts will answer those questions. And also you will be given like an opportunity to ask questions at the end. Yeah, so let's continue. Dr. Njunga, you talked about excessive rains, that they are also contributing to the distribution of zoonotic diseases. Maybe if you could give us an example of a zoonotic disease that happened in Malawi due to excessive rains.
Yes, I deliberately, left the issue of too much rains result, changing the topography of our landscape. What I'm trying to say is, there are certain zoonotic diseases like anthrax, for example,
Yes.
whose spores reside in the soil. That is the spore form of the anthrax. So once those spores are exposed to oxygen, then they germinate and become what we call a vegetative form of the anthrax. That's the one that is very, very dangerous. So once those spores are exposed because of excess, rains that causes flooding, then we've got a problem. And now for you to understand clearly, I want to present a case study that happened in Malawi. That was around 2018, 2019. So just give me a minute. I want to show you something in form of a presentation.
Thank you so much.
So the title is Handling an Anthrax Outbreak in a One Health Approach. Dr. Fausta talked about, One Health in her, introduction. So I'm going to give you more details about how this works in terms of, disease control and prevention. Okay. Now, before I start, I want to acknowledge my colleague, Dr. Joseph Nkoma, who worked hand in hand when we were investigating this outbreak together with our colleagues from Ministry of Health, Environment, and Security. Together, we managed to handle, this case. And this presentation was actually, also presented in Arusha when we had an international meeting where my colleague, Joseph Nkoma, presented it. So I want to acknowledge him, before I start everything. And I'm sure he has joined and is listening. And in case there is something he wants to add, he will be most welcome to do that. Okay. So this is what I was talking about, an interface between humans, animal, and the wildlife. Okay. This is an introduction of the exact site that I'll talk about, right? This outbreak occurred in Liwonde National Park. Malawi is lucky. We've got quite a number of wildlife reserves. So one of them is Liwonde. And this Liwonde National Park is one of the 3 main parks which is now being managed by African Parks in partnership with the Malawi government through the Department of Parks and Wildlife under the public-private partnership. And for more information, the district is shared with other 3 districts called Balaka, Machinga, and Mangochi. For those people who've been to Malawi, they should be able to understand because these are very, very popular sites in Malawi. And the national park, in terms of size, it's big. It covers 580 square kilometers and a stretch of 27 kilometers of the river, the popular river in Malawi. Why is it popular? Because it's the only outlet of our beautiful lake, Lake Malawi. And it covers a 115-kilometer stretch of electrical fence to avoid the interface that I was talking about. So the wildlife is protected from the domestic and people by a wire and electric fence, which was installed by the parks and African parks. And the park is home to a variety of animals, ranging from leopards, hyenas, elephants, lions, and very, very beautiful birds, as well as fish species that Malawi is known best for. And that map, if you can see, it's actually the red arrow is showing where exactly the Liwonde National Park is located. And by the time we had an outbreak, there was an estimated population of 2,300 hippos. So you can imagine how big the park is. Now, you may be wondering that did we had any outbreak in Malawi of anthrax? The answer is no. We had never had any outbreak. And if you go into our records and history, it showed that the last outbreak was, should be from today, I would say maybe 73 years ago. That's when we had an outbreak. But all along, we can imagine that most likely the spores were actually hibernating in the soil, as I said earlier on. And because of the heavy rains that we had between 2018 and 2019, that's what we believe in, that it excavated those spores, exposed them to oxygen, germinated, and caused the outbreak that we had. And for your information again, the outbreak was first reported on 10th October of 2018. And by 29th November, from the day we saw the first case, we had lost 28 hippos. And by the 9th December, the number or the figure rose to 38. And by the end of December, we had 45 hippos lost. And by mid-January, we lost 48 hippos. And that's a lot, of wildlife lost within a short period of time.
Yeah.
Now, maybe some of you may be wondering, what I've just talked about anthrax. What is anthrax? So let me just give you a brief, history about the disease. Anthrax is an acute infectious zoonotic disease, which is caused by a bacteria, which is a spore-forming bacteria called Bacillus anthracis. And the name is derived actually from a Greek word, which refers to core, because of the dark spot of the ulcer that is caused, when people are affected. And it most commonly occurs in wildlife or domestic animals. In other words, all warm-blooded animals can actually, get anthrax. And it looks like cattle, goats, sheep, buffaloes, and the hippos are the most, affected. And it is a very, very serious zoonotic disease. Already Dr. Fausta talked about zoonosis, that these are diseases that are transmitted from animals to humans, and again from humans back to animals. And animals do get infected mostly, by ingesting the spores, as I said earlier on, which is once it germinates into the vegetative form. And once exposed to air, the bacteria produces the spores that are extremely hardy and withstand extreme temperature, extreme conditions. A good example is what I explained, that, it took more than 70 years for Malawi to have an outbreak of anthrax. And yet, we believe the spores were there, only that the environment was not conducive for them, to start sporulating. But that happened because of the surveillance, which is attributed to climate change. And for information, anthrax, it's a notifiable disease. And once a country, confirm an outbreak of anthrax, we are supposed to report that to World Organization for Animal Health. For old people like me, we are used to the word OIE, but now the word has changed to World Organization of Animal Health. So it's a must that if a country, reports anthrax, it must be reported. And again, it's a requirement under the international health regulations that diseases, they don't see borders. And a problem in one country is a problem to another country. Therefore, we are supposed to report through, WOWA, which then transmit that information to the rest of the world through a platform called WAHISI. Now, how is the disease transmitted? Anthrax does not typically spread from animal to animal or from person to person, or from person to person through contact. However, the bacteria produces spores on contact with oxygen, as I said already, and those spores are extremely resistant, survive for so many years. Then, if ingested or inhaled, an animal or human, or upon entering through any cut through the skin, then the spores germinate and cause the disease. Carnivores and humans can become infected mainly through ingestion because of their eating behavior. But again, animals become infected by ingesting spores, which are in the soil or any contaminated material, including feed. Now, what are the signs of the disease in humans? In humans, the signs depends on the mode of transmission. If it is through skin, through the cuts, as I said already, then the human being develops some skin lesions. But sometimes they can get it through ingestion, then they'll have some ulcerations or lesions along the gastrointestinal tract. And if it is inhaled, then there'll be some problems or some lesions in the pulmonary system. So that diagram, it shows an arm with an ulceration. That means the anthrax went through the skin. And the second picture, it shows some lesions along the pulmonary system. And the last one, it shows infection along the gastrointestinal tract. Okay. Now you can see that little innocent boy. Unfortunately, he got infected close to the ear. So you can see that the head is swollen and there is also a red spot or is a hemorrhagic area or an ulceration, right? Just very close to the ear. That's how pathetic, the disease is. So tragically, people who lost their animals may also lose their lives as they are, salvaging the meat. And this is very, very typical under African setup, that when an animal dies, right, first thing they think it's about the meat. They don't really care or matter to find out why has this animal died. And because in villages, to access meat, it's very, very difficult. Then people, they take advantage of it and start consuming. So it becomes very, very, dangerous if that meat is infected with, a zoonotic disease like an anthrax. Okay, I've already talked about cutaneous form, gastrointestinal form, and inhalation, so I'll not, talk much again about that. But what you have to know is that over 95% of cases take the cutaneous form because of the direct contact. And at high risk are animal health workers, livestock producers, agricultural workers dealing with sick animals, or in short, people who are in direct contact with either the animal or animal products, like, for example, wool or hides that originate from animals that were suffering from anthrax. Yeah. The rest of the information, it's already covered, so I'll not talk about those once again. We just have to go to the clinical signs in animals. Okay. So in animals, the signs can either be per-acute, acute, or subacute. Acute, when you talk about per-acute, it means you will not even be able to notice that the animal has been sick. You just find that the animal is dead, right? Sudden deaths. Or acute. Acute, then you should be able to see the clinical signs, or sometimes subacute. But again, this also depends on the virulence of the anthrax or certain factors in that animal, either the immune status of that particular animal. When the immune system of the body is weak, then the disease easily come in, and when the immune system is strong, then the body tend to resist that infection. And that's if the immune system is very strong, then you may have, or the animal may show some subacute signs. However, the clinical signs may be virtually absent in peracute, already said, but in ruminants are most often found dead with no indication that they had been ill. In an acute form, there may be fever, muscle tremors, difficult breathing, etc., etc. And subacute form, as I said already, there could be hardly any signs. However, you could have, or the animal may show some progressive fever, or some people call it intermittent fever. The animal could be depressed without any known reasons. It could lose appetite, become weak, and prostration, followed by death. In the carnivores, when the animal feeds on an infected source, there may be an intestinal form of the disease, which I already explained in one of the slides when I was defining the cutaneous, inhalation, or pulmonary. Okay, now let's go to the most interesting point, and that is the genesis, why I decided to come up with this presentation. As I said, Malawi, we had almost 70 years without any problem with anthrax. Then suddenly in 2018, it just started. Now, the aim of the outbreak investigation that we carried out was, one, to activate and strengthen a local multi-sectoral teams for outbreak response. For information, Malawi, noting the importance of One Health, as already explained, we decided as a country, to prepare the nation in terms of, disease investigation that would require One Health approach. So there is at central level a committee that takes care of, One Health issues, and at sub-regional level we've got some committees, and at district levels we have, sub-committees. But since these committees were tested, it was only when you're doing some simulation exercise on Ebola, when our neighboring countries, especially the northern border, they had some problems with Ebola. So we had some simulation exercise. But to have a real scenario, real-time scenario of a problem, it's when we had this anthrax. So we took it as an opportunity also to activate the local rapid response teams that were formulated, just to check how prepared they are. That was one of the reasons among the investigation. And secondly was to determine the magnitude of the anthrax outbreak. So there were surveillance in humans, livestock, as well as the wildlife, and also assess the outbreak local RRT capacity. And again, which was the most important thing, was now to mount an effective control and preventive strategies using the One Health approach, which for us worked perfectly well. And I'll explain why that, why that worked like that. And some of the activities that we did were active searching of suspected human cases at health facilities, and also doing the same on the domestic animals at what we call deep tanks. These are places where animals are, aggregated for either health checks, or if there is anything that the communities want to do with the animals, they bring them to a local, deep tank. And also physical counting and disposal of, the hippos that died. Lucky enough, our colleagues from African parks, they mobilized, helicopters. Those are the machines that we're using, to locate the dead hippos. and remove them from those sites for proper disposal. Okay. And again, collection of specimens from the hippos, to be taken to the laboratory. Some we kept as our reference materials, but for the first samples, it was actually for diagnostic purposes. And the first diagnoses were done on site, right? Because the moment we suspect that it's the anthrax, we didn't want to expose too much of the spores for the same reason that I said already. So what we did was to do the test on site using the basic test. So when you saw that we were seeing those bamboo-shaped, bacteria, then we took extra measures to take them to the laboratory where anthrax was, confirmed. And immediately we started, mobilizing meetings with the local communities, sensitizing them about the problem. And those meetings, or sensitization meetings, we went there as a complete team, people from the environment, people from security. At first, we're using police, but when the problem was becoming too much, we actually involved the military personnel who are within the district. And of course, traditional leaders also played a very, very important role, because we noticed that when people from the Ministry of Agriculture or from the Ministry of Health went there with messages, people in their local areas, they take them for granted. But when you use the local authority, even the church leaders, then they take that message very, very seriously. And that's the approach that also used. Again, through the same concept of, One Health. Okay. Now, how did we manage? Okay, before I proceed, let me inform you that we managed to contain this outbreak within the wildlife population. Okay, let me put it this way. We managed to contain it within the hippo population. There was no spillover either to domestic animals as well as the human population. One of the reasons, of course, is that the place is fenced, as I said earlier on. It is the whole park is fenced using an electric fence, but still more, there are certain places where the park is easily accessible, especially areas which are very close to the river. And some of the hippos actually leave the park because they spend most of their time along the Shiro River, which is not fenced on the other side. So there was a high probability for the disease to spill over to the domestic animals as well as humans. But we did intensive surveillance, both from the domestic, the humans, and other wildlife species. But we noted that it was only the hippos that were actually affected. And we clapped hands for ourselves because it was remarkable. The achievement was remarkable. Okay. And we continuously held press releases, right? And the press releases were done at 3 different categories. First was at central level, where we're writing memos to the minister and to the folk nation to know about the problem. And secondly, we had, special press releases for the districts, plus and the surrounding districts. And more importantly, we had, special releases from the surrounding communities. And from the surrounding communities, it was easier because we were using, in Malawi, we've got the special Land Rovers with speakers on top, right? So we're using those to announce around the area, to sensitize people what they should do to prevent the problem from, affecting them. Okay. Right. So the others have already said that samples were collected and confirmed. Initially, the initial confirmation was done at Central Veterinary Laboratory, but the moment we saw that this is most likely, anthrax, then we sent more samples to the Public Health Institute of Malawi, who have got, by that time, they had better facilities for diagnosis. And again, they confirmed it. And even our reference materials, they have been, safely kept there. And we were very, very careful in how to handle, this outbreak, because as you know, some people, some funny people, they can actually use anthrax spores to make, biological weapons. And we made sure that none of the, samples escape. right? Because we knew that we could have some strange visitors who would want to come and access, these hippos. So there was a very, strict security at the Public Health Institute of Malawi, where our samples were kept. And again, around the Liwonde National Park, we made sure that there was a very, very tight security by using the police as well as the Malawi Defense Forces, so that the park was well secured to avoid, such kind of people. Now, what exactly did we do in the communities using that, yellow van or the speakers around? So first of all, the Department of Animal Health actually constituted a ban that no slaughter of, cattle, goats, pigs, all the animals around, domestic animals, we suspended, slaughter, all right? Because when people slaughter these animals, they sell the meat, okay? So you never know. Others could find an animal dead and they take it and start selling. By the way, by doing that, it means they'll be spreading the anthrax. So we stopped selling all the meat. And then the district response plan was drawn in a One Health approach, as I said earlier on, and we intensified disease surveillance in communities to trace those who came in contact with the meat and in health institutions. Okay, this surveillance was not just on the animal side, but it was also on the human side. So for the human side, they were using health posts, because within the district, we've got small satellite, health posts where people come if they get sick. So in all those areas, we're doing, some surveillance. And it was active surveillance, not just passive surveillance. We're using active surveillance. From the Ministry of Health side, they were using a certain caliber of staff. They're called health surveillance assistants. And from the animal side, we're using the assistant, animal health officers. These are auxiliary staff who are employed by the government, but they are located in the villages. They're the ones who stay with the people in the villages, and they're the ones that played a greater role in terms of, surveillance of this anthrax. And for the workers who were working in the park, again, they were quarantined, all right? And those whom we deemed to be at a very, very high risk were actually given, some prophylactic treatment. And as I said, the defense forces were deployed, to prevent people from scavenging, the carcasses. Okay. Now, for prevention and control of the disease, if the animal or humans are sick, you can use antibiotics. High doses of penicillin, for example, they do wonders. All right. But the most important thing is to provide, vaccinations, which lead into, immunizations. And in particular, besides treatment and immunization, people should pay special attention to the following. One is the proper disposal of dead animals. It's very, very critical. Some people may be tempted that, okay, they should just pile up the dead animals and burn them. That would be a big mistake, because by burning them, the animal can explode. And once it explodes, it can actually splay, the spores. And that would be a serious problem. All right. So the approach that we used for the dead hippos, we were actually digging big holes using excavators and throw them there and put quicklime in just to neutralize, the spores. Then later on, you bury them. We found that to be more, effective. And again, another important thing to notice that the area where the disease has been confirmed, it must be quarantined for as long as it can, or as long as resources can provide. For us, the quarantine was pretty long until the entire rain season, stopped. And we also counted from the last day that we saw a clinical case. We had to count until almost a month to make sure that we do not have any more problems. And then the area was open. But again, up to now, we are still telling people that the fact that we had an outbreak in 2018, and we know that that area is now fully infested with this force. Initially, the spores were buried deep into the soils, and the severe rains, they actually excavated them, but now they are on the surface. So people, they must be on the lookout. And again, people who are grazing their domestic animals around the park, they were told to stop that with immediate effect, and it really worked. Okay. All right. With that, I would say thank you so much. I know I was very mindful of time. That's how I was speaking much, much faster. But I hope the people have managed to get the concept. Thank you so much.
Thank you so much, Dr. Njunga. It was really interesting, and I have a lot of questions, but then due to time, I won't be going into the question. I don't want to eat the audience's time for their, because they are the ones who are supposed to ask a lot of questions. Yeah, but then if I heard you right, did you talk about the disposal? You talked that it's very important to dispose properly, but did you talk how can we dispose properly? Maybe you can just
Yes.
answer that one.
I can advise is the animals, you have to dig a big deep pit, right? You deep pit, get the animals in and get lime, all right? That's caustic lime. So the idea is, don't just dig, put the animal and bury it. Then you are incubating the spores. As I said, they can live there for a long, long time. So to make sure that the spores are killed, you have to put in lime. Lime is caustic. So once the spores are exposed to lime, then
Oh, I think we lost Dr. Njunga, right? Dr. Foster, can you hear me?
Yes, I can hear you well.
Okay. Thank you so much. Dr. Foster, do you have anything to add on the anthrax issue?
No, except that I would say that I really like the case study. It is really interesting and it was very informative. Yeah.
Okay.
Stella?
Thank you
So sorry to interrupt. Maybe we can ask Dr. Joseph Nkoma if he has something to add. And I will check with Dr. Njunga if he's able to rejoin.
Okay. Marit, can you help unmute Dr. Joseph Nkoma?
Yeah, I've made him a co-host, so he's able to actually unmute himself.
Okay. Thank you.
Hi. Thank you so much. It's a shame that Dr. Njunga dropped off, but because I really didn't look at okay, he's back. So
Yeah.
so I think he can continue from there. Thank you.
Thank you so much, Dr. Nkoma. Thank you for stepping in. Thank you so much. As he has explained that when you're disposing, it's encouraged that you dig deep and you add lime, caustic lime to kill the spores. Thank you so much on that. Dr. Foster, now I'm coming for you.
Yeah, I'm ready.
Yeah, in your presentation, you talked about the viruses that are zoonotic in origin. You talked about HIV being one of them, and you also talked about Ebola. Yeah, maybe can you shed some light on that one? You also talked about COVID-19 being one of them. How did this pandemics affect the policies and the strategies of One Health?
So what I can say is that we owe so much to these viruses. I know it sounds weird because they are viruses and they kill a lot of people. But in African countries, maybe if I take an example of Rwanda, we have infrastructures built mainly because of these viruses. So we recently published a paper on the systematic review on the patterns of viral research in Rwanda. Human and animal viral research in Rwanda. And from that paper, you can see that this type of research, the viral research in Rwanda started in the 1980s. Those are the time where HIV was hitting and was coming in this region. And of course, it was new and there was no laboratory and all that. So there was some research, mostly reactive research, some less proactive research, but the infrastructures were built, and even some of them we still have because of this HIV virus. We have continued, of course, not only because of HIV, we have continued to build these infrastructures because of other diseases are there. But this was the pioneering efforts were catalyzed by HIV. So, of course, it was also a call to people that there's a possibility that animals can come from that disease can come from animals. So this is already the One Health concept. Now, when you come to COVID, I don't know, sometimes when I teach my classes, I don't know what I would do, how I would teach my courses without COVID-19 example. Because COVID-19 is a perfect example of how One Health works. So Dr. Njunga explained the One Health approach where they used when they're handling anthrax outbreak. This is exactly what happened for COVID-19 in all of the countries. So there was coordinated effort between all different factors. Between, of course, in our country, for example, there was the control and the command was done by the office of the Prime Minister, which is really on the top, and then all the ministries were involved: the Minister of Health, the Minister of Agriculture, the Minister of Defense. We had a very big involvement of from the local government. As Dr. Njunga said, when you go to see the community and you don't have their leaders, they don't listen to you. You need to have the local leaders. So the police was there. So it was really the highlight of showing the One Health importance. And for Rwanda, for example, during the COVID time, that's the time when One Health policy was signed by the cabinet. So One Health, we have a One Health workforce that has been there for some time. We have been having some strategic plans, but they were just there in the drawers. Even in the ministry, it was like a matter of the Ministry of Health. But when COVID-19 hit, everyone was like, okay, this thing now is serious. Everybody should be involved. So in March 2021, that's when the One Health policy was approved and signed by the cabinet. So this is what I can say about HIV and COVID-19. How they affected One Health in Africa, especially in Rwanda. Thank you.
Thank you so much for a very insightful explanation on the zoonotic origin viruses and how they have affected the One Health approach. Yeah, Dr. Njunga, do you have anything to add on that one? Again, you're muted, Doctor. Okay, as Dr. Njunga unmutes, I see some hands up. We'll get those questions when we're done with this panel questions. We just have a few to go, so we'll soon get to you. Okay, Dr. Njunga, I was asking if you have anything to add on what Dr. Fausta has said.
Yeah, maybe just one example to add. All right, we had a scare on Ebola in Malawi. All right, because of the northern corridor close to some countries which were affected by them. Now, again, we thought, using the example of the anthrax that I got, the approach was to conduct a simulation exercise. And again, Ebola being a zoonotic, then again, it was the same teams. Us from the veterinary, colleagues from human, and guys from the environment, because that's where all these things are interfacing. So we need to involve them. So everyone was involved in that. And the simulation went on very, very, very well. Right? The security, again, was involved. And the security was mainly involved to take care of us too. Because by the end of, when you are doing simulation exercise, the time you are now telling the public that it was just a simulation, other people, they don't just take it like that. No? So we're supposed to be protected as well. So that's what happened. And it went on very well. Thank you. Otherwise, most of the things have already been, said by my colleague. Thank you.
Okay, thank you so much. I won't take time, but to move to our next discussion. We have talked about zoonotic diseases, but what are the risk factors that people may not know, but they are there, like they're the risk factors for the zoonotic diseases, for the emerging of these zoonotic diseases? Dr. Njunga, that's yours.
Okay. Thank you so much. All right. I know there are these obvious risk factors, but I'll focus more on the hidden ones that not many people are aware of. All right. Number one is the human behavior. All right. Human behavior can be a risk factor for transmission of zoonosis. I'll give an example. There are certain, cultures that, consume raw meat, for example. Okay.
Yeah.
So for them, when they consume raw meat, that's when they say they enjoy it more. But it has got some risks, which unfortunately they don't know. There are problems like, for example, porcine cysticercosis, even bovine, cysticercosis, which end up causing neurocysticercosis in humans, or trichinella spinalis in pigs, that can cause serious problems in people. So if people, because of the behavior or the cultural, influences, those can actually be a factor for transmission of this zoonosis. The other factor is population growth, like my colleague said. As the population is growing, right, there is a lot of contact. And again, people, normally, we do keep companion animals like our pets. And there are certain people, they love their pets so much, that they can't do without, holding them. And others actually, sleep together, maybe in the same room, right?
Yeah.
All those things are risk factors, but yet people, they don't know. They're not aware of those things. The other factor are basic hygiene factors, right? People do advocate that before you eat anything, you have to wash your hands, right? But how many people do that? Very, very few people. And all those are risk factors for transmission, of these diseases. Then the other factor, which again, not many people, may be aware, is, migration, all right? Sometimes people are allowed to enter country because of civil conflicts from the other side of the border. And as the people are moving from one place to another place, should there be a problem, with one or few individuals within that population, but as they are moving, then they've got a problem. The other factor, Dr. Fausta talked about already, about urbanization, right? That's another, risk factor for zoonotic disease transmission, because many people believe, okay, let's go and settle in towns or peri-urban towns, right? And the more people are going there, some are carrying problems, and they're carrying with them, into those new locations. As such, then diseases are spreading. And I can feel that, people are actually, surprised, right? Because people, they think about the obvious zoonotic ones. And another important one is what I said already about the love of pets, right? And if we manage our pets nicely, we vaccinate them, all right? For example, the issue of rabies, which you said yourself, a sailor, which you talked about it so passionately, right? The issue of rabies. So if we are keeping our animals within the homestead, we are either keeping them for security or we are keeping them as companions. If we don't take care of them through vaccinations or give them proper food so that they shouldn't move around looking for food, then they can contract rabies, which is a zoonosis. And that rabies will end up, into us as humans. So those are, some of the hidden factors that many people have to know, that these are risks as far as zoonotic, is concerned. The other one may not very, very important, but it is important. Yeah? When you talk about, vector-borne transmission diseases that are transmitted by these vectors, right? It means when you are going there, you have to know about them and prepare very well. Either using simple things, carry insect repellents when you are going to an area which is infested with, say, for example, mosquitoes or ticks, right? If you can prevent yourself from getting into contact with those insect vectors or or parasitic vectors, then you should be able to protect yourself. But how many people do that? All right. And the reason is they don't know that those are some of the risk factors. Maybe Dr. Fausta can add. I know there are a lot, but I was just focusing on the ones that people may take for granted. Thank you.
Thank you so much, Dr. Njunga. Dr. Fausta.
I think he explained it well. Yeah. Maybe we'll continue interacting through questions as people ask questions. Thank you.
Okay. Then I think before we go into questions, we should quickly discuss an important part of One Health, the antimicrobial resistance. Maybe if you can explain to the audience what antimicrobial resistance is and how climate change is contributing to it. Yeah, we should start with you, Dr. Fausta.
Okay, so antibiotic resistance and antimicrobial resistance. So, those diseases that we keep talking about, they are caused by microorganisms. So those are bacteria, viruses, fungi, and parasites. So when you do treatment, the treatment are targeting them. So the treatment is supposed to kill them. So what happens when there is a resistance is that those microorganisms become less susceptible to the treatment, and they are not killed completely, or sometimes not even at all. So I sometimes say that what does not kill you, it makes you stronger. So if you if you don't use the right dosage, you're going to sub-kill or to not to kill you're not going to kill the pathogens. You're going to maybe weaken them a bit, and then when they come back, they're going to come back strong. That is what is, if I try to explain briefly what is antimicrobial resistance. Now, how is climate change affecting it? Climate change, as we mentioned already, comes with changes in temperatures. This is going to accelerate some maybe microbial growth rates, and it might have an effect on their mutations. And then the changes in precipitation patterns. The flooding can spread the resistance pathogens, because when there's flooding, the water will move from different areas. If maybe the pathogens were in this area, they're going to move to new ones. And then the drought can concentrate antibiotics and resistant bacteria in water sources. So I can go on and on, like extreme weather events can damage infrastructure, leading to poor sanitation, increasing infection rates. This also might disrupt the healthcare services, So, and of course, as we also keep talking about human migration, the human migration can be voluntary, it can be involuntary, maybe, caused by climate change. So this movement can also spread the resistance pathogens to new areas. Yeah.
Thank you so much, Dr. Fausta, for that. Dr. Njunga, anything to add on that briefly before we go to the questions?
Yeah, maybe I can just add one. That is, a poor waste disposal. That can also lead to, antimicrobial resistance. For example, at an abattoir, I'll just give a veterinary example. At an abattoir, maybe there are a number of animals that have been brought in for slaughter, and some of them they are carrying these antibiotic resistant pathogens, right? So the effluent from the abattoir, if it is not properly disposed, it will end up spilling in the environment, and by doing that, it's now spreading that. And should it be maybe closer to where some other animals are grazing, then those animals, again, once they consume either feed or water that is coming from that, that waste disposal, then they'll get the resistance. The same concept can apply to, human hospitals, for example. Okay, human hospitals which do not have appropriate, disposal facilities like an incinerator. If they just dispose of anything from the hospital, which is culling lots and lots of these antibacterial resistant bugs, then they'll spill over into the environment and the problem will continue. Yeah, that's the only one that I can add, but majority have already been explained. Thank you.
Thank you so much. So I think we have a lot of questions from the audience. We should go to the questions. Someone who have been raising for hours now, so we should go to them first. Then, yeah. So what we'll do is we'll get one hand, then read one question from the chat. We'll be exchanging like that. Yeah. So I see Monique Ndame, you have a question. You've been raising your hand for so long. Can you please unmute and ask your question?
Okay, good morning, good afternoon, and good evening, everyone. I am Dame Monique. I'm a veterinarian from Cameroon. I want to congratulate Mr. Njunga and Dr. Futsan for their work. I have a lot of questions is about anthrax because they taught us in school that in case of anthrax, we should not touch the corpse, and because it's really a disease, a bacterial disease that kills fast. I want to know the prevention measure that they took in Malawi for the anthrax disease, if there is any wildlife vaccination against the disease, vaccination from humans. And another question, Dr. Fausta is, are there vaccination for rabies, effective vaccination on both on human and animals? And I didn't really get when she was saying the increase of population also have an impact of the rabies spillover.
Thank you so much, Monique, for the questions. Dr. Njunga, will you get the first question on anthrax, and then we go to Dr. Fausta on the rabies one?
Thank you so much, Monique from Cameroon. Yes, in fact, your teachers were very right that, anthrax is a very dangerous disease. And if you suspect a carcass with anthrax, don't touch it. All right. I do tell my students the same message. Even my family, I do tell them the same message. So what prevention measures did we take, in containing this outbreak? If you recall from my presentation first, I said, when we suspected anthrax, the first day we suspected it, we did not even want to carry that carcass or to open it up. What we did was to just take, because it was bleeding, we took a blood smear, a quick smear right there on site. We had carried our microscope. We did examine. The moment we noticed that, there is suspicion of anthrax, then we said no more opening of this carcass. So the samples that we're taking were actually from the external orifices, right? They're the ones that we took. In addition to that, before taking those samples, we made sure that we are well protected in terms of personal protective clothing. So everyone was gloved, right? For the guys who were taking the samples, they had to put on these plastic goggles to prevent spillage into their eyes. That is now the sampling teams. And the teams who were investigating, as I said, that it was one health approach, which means there were some people from the medic, either veterinary or human, right? And the people who were getting the samples, they were only the veterinarians. The rest were not allowed to come closer. And the other team from the environment, all right, they were not even allowed to get even closer because their job was actually to appreciate what was going on. And for the media, again, they were waiting for press releases. They were not allowed to go, to go there. And for the people who were in contact before we came in, these are the people from the wildlife. They are the ones we said they have to receive, prophylactic, penicillins, just in case they have been exposed. So we didn't want them to get in contact. But all in all, we minimized as much as possible contact from these animals. And when it came to excavating or getting the hippos out of the water, we were using helicopters. which had a hook. So you just have to go in, hook the hippo. It was a very, very tedious task. Fortunately, we had very expert, helicopter pilots who were able to maneuver to get the hippos out of the water and bury them, where a lot of lime was used to ensure that the spores were completely, deactivated. We could not deactivate 100%, but we managed as much as we could. And finally, the area was put under quarantine to ensure that nobody gets close to that area. And it was under the custody now of the Malawi police as well as the military, who again were well sensitized about the dangers of anthrax to make sure that they should not be in contact. So those are some of the key issues that we took to ensure that there was no exposure. Thank you.
Okay. Can I go in with my questions?
Yes, please.
Okay, so thank you, Monique. I think you had two questions. The first one was about rabies vaccine. Yes, there is a rabies vaccine. I will talk about the case of Rwanda. So it's mandatory to vaccinate dogs and cats because, vaccine is there. But for people, the vaccine is there, but it's not mandatory to take vaccine unless you work in a high-risk zone, or if you get exposed, what happens is that you will get to the hospital, you have serotherapy, and then you will immediately take the vaccine. Because as you know, if you're a veterinarian, you understand the concept of vaccination. Vaccination takes it's an active immunization, which takes a long time to build. So, but when you get exposed, you immediately need antibodies. So you get serotherapy, at the same time you get the vaccine, so that by the time the vaccine is building antibodies, you have immunity from the serum. So the second question about the human population influencing the rabies prevalence, I didn't say this specifically in terms of rabies. It was generally for zoonotic diseases. So as the population increases, you're going to have more people. That means high density, of course, high susceptibility. But also, if you take this in terms of prevalence and of rabies, maybe you can consider not necessarily human population, but maybe animal population, dog population, cat population. But when I said this, it was mainly generally like for also the zoonotic, basically zoonotic diseases in general, not even zoonotic diseases only. So when you have more people, you have more likelihood to have diseases. Yeah, thank you.
Thank you so much, Dr. Njunga and Dr. Fausta. Now I'll ask my colleague, Robert, to read one of the questions from the chat, a hot one, before we take another hand. Robert.
Yes. Thank you, Dr. Sela. So there's someone called Aliza. She asked if, she said, "Hi, I'm wondering if you could point out some existing networks or collaborations that are seeking to address zoonotic diseases using One Health approach. I'm wondering if you can point out success cases of where this is already happening in a systematic way on the continent." I think she addressed the question to both of the speakers.
Yes.
Yeah.
Okay. Dr.
Can I go
Fausta,
in
you can go
first?
first. Yes,
Yeah.
please.
Thank you, Sela. So maybe I can mention two One Health networks on the continent that I am already aware of. The first one is AfroHON. It's Africa One Health University Network. It is in, I think, 8 countries: Cameroon, DRC, Rwanda, Ethiopia, Kenya, Senegal, Uganda, Ivory Coast, and Liberia. So they do not only handle zoonotic diseases. I mean, they are generally working on One Health issues through the universities into those countries. Of course, through different projects by faculty and students. But as you know, One Health people are always accused of always putting zoonotic disease in front, as if it was the only One Health issue. So of course, this translates that most of the work they do, it's going to be mainly zoonotic diseases. So the other network that I am aware of is COHESA. It's a project. It's a big project. I think 5-year or 10-year project. I can't remember well. It's called Capacitating One Health in Eastern and Southern Africa, COHESA. It's also in different countries, including Botswana, Ethiopia, Kenya, Malawi, Mozambique, Namibia, Rwanda, Zambia, Zimbabwe, Somalia, Tanzania, and Uganda. So those are, that project is really, it's mainly working on policy, One Health policy, and making sure that, you know, One Health is heard, especially at national levels. Yeah.
Thank you so much, Dr. Fausta. Dr. Njunga, do you have anything to add?
Yeah. Not much to add, but the one I wanted to say is what she has already talked about, the COHESA, because that's the one I know very well. In Malawi, it is there and it is housed at, Lilongwe University of Agriculture and Natural Resources. They are very, very powerful. We do have, almost quarterly meetings connected by the Kenyan office. That's what I know most. Apart from that, we've got our own, local network, but I'm sure she was interested in the international network. Our local network is being, coordinated by the Public Health Institute of Malawi. That's again, that's what I know of. Apart from that, I know a number of initiatives which are being coordinated by World Organization for Animal Health through the regional offices, like the one we have in Botswana for the southern part of Africa. They are also busy coordinating, One Health agenda. Thank you.
Thank you so much. So right now I should ask Evaristo. I'm not sure if I have called your name out correctly. Evaristo Bruder. Can you please unmute and ask your question?
Okay, thank you for a nice presentation, but I just joined later, so I have one question. What is a principal hosts or receivers of anthrax, specifically for wild animals? That's the first question. And the second question, how does poaching affect the emergence and reemergence of zoonotic diseases, particularly in areas close to wilderness, I mean? Thank you.
All right. To start with, you were talking about what is the main host for, anthrax in the wildlife.
Yes.
All right.
Yes.
If you go into literature, and of course, from what I know too, the hippos, they feature highly. But apart from the hippos, even from my presentation, I also talked about the buffalo, the cattle, the goats, but the most prominent one is the hippopotamus. I may be wrong, but that's what I got from literature and also from our experience. And even within the region, especially us in the sub-Saharan Africa, if you read about anthrax outbreaks, most of them are from hippos. I got it from Zambia. The outbreaks they had, they affected the hippos. In Zimbabwe, the outbreaks again affected hippos. And in Malawi, again, the outbreak affected, the hippos. Then regarding the second part of your question, that how do poachers, influence the spread of zoonotic diseases? Yes, poachers are a risk to zoonotic spread, not just a risk to zoonotic spread, but it's also a big risk for them, right? Because when they are poaching, the meat is not inspected. Once they find an animal, they slaughter it, no inspection takes place, they just either consume it or they start selling it. So they are indeed a big threat to spread of zoonosis. And I also talked about certain problems, like for example, trichinella, Trichinella spilaris, which is found in pigs and wild pig related animals, like the warthogs, for example. And the poachers, those are the easy catch that they do get. So again, they can kill a warthog which has got trichinella, and they start selling that animal. And the problem with trichinella, they will not be able to see it, with their naked eyes, because they need it's more of microscopic. They need a special gadget to know that this meat is affected by trichinella. So indeed, poachers are a big problem to the spread, of zoonotic diseases. Thank you.
Okay, thank you for a nice response.
Dr. Fausta, do you have anything to add on that?
No. Yeah. I think, and of course, it's really known that poaching is not good. I think Dr. Njunga explained it well. Thank you.
Okay. Before we read another question from the chat, I will ask Dr. Koriwe to unmute and ask her question.
Okay, thank you very much, Sarah. Can you hear me? I guess
Yes,
you
we can hear you. Yes,
Yeah,
we
thank
can.
you for the good coordination. That's an excellent coordination with your colleague. And thank you very much, Dr. Njunga, for enlightening us so much, and Dr. Foster. Yes, Dr. Njunga, you answered most of my questions I had, but I was left with one only for you to say. You had said by the end of December 2018, it was like 48 hippos had died in Malawi. How did you verify that there was none after that? Could they be maybe 50? Could they be 60? Or maybe 70? Or the search was intensively done? And what about the hidden carcasses? How were they searched that you are done with the dead ones and you have lifted them out? Could you enlighten us on that? How sure could you be that most of the dead hippos were cleared? Or were there some unattended?
Thank you so much. In my honest, response would be all the hippos were accounted for. The reason is, one, most of the hippos, they were found in water, right? And the surveillance was done all along the, the Shire River stretch that is covering along the Liwonde National Park. And in addition to that, you know very well, Dr. Kandawide, that at the Liwonde Bridge there is a barrage. Okay, so some of the hippos were actually being found there. Okay, those which escaped the park, they were found, along the barge because they couldn't pass through because of the gate valves that allowed only water to pass through. So that's why we are saying we all counted all the hippos. And by the time the water, subsidized, there was literally no evidence of any hippo that was there. And again, one thing you have to know, maybe we can say when the hippo died, it goes under the water. But after some time, they get excavated naturally. So they will be floating on water. So there was no floating hippo. And because of the helicopter that we're using, it was just, moving around continuously. But Joseph Nkoma, my colleague who was actually on the ground most of the time, probably he can also, come in and join. Thank you, Joseph.
Hi. Sorry, I missed Dr. Gandawire's question or whatever you were answering because I had briefly lost connectivity.
Okay. Yeah, let me just brief you quickly. The question was about, I reported that by the mid-January, when we had declared now the outbreak was over, we had counted, 48 hippos that died. So her concern was, how sure are you that only 48 died? Don't you think there was maybe some which were hidden? So my explanation was, we made sure that we had to count for each and every hippo that was floating on water. And at the same time, there was a deliberate effort to scavenge around the Rwanda Bridge barrage, the entrance, where we managed to get some, some few, hippos which got stuck from there. But as far as the rest of the river is concerned, there was a helicopter who was, doing aerial surveillance. So there was no evidence of any hippo that was floating. That was my response. But I thought since we were on the ground, most of the times you could have something to add.
Yeah, no, you are right, because that actually is exactly what happened. So there's aerial surveillance using helicopters by Africa Parks, and then the counting at the Liwonde barrage. And then they were sending, so they were updating us on a daily basis, the counts, the new counts. and they located these hippos on a daily basis. So if they knew, I mean, if we miss, it will be insignificant numbers, but I think we're quite sure that it's really, 48 plus minus maybe very, very few. And we counted up to the time, they counted up to a time that we saw there were no more new cases. And you could see when we counted up to 48, indeed there were no more new cases. The 2 incubation period, cycles or the 30 days elapsed, and then the ban was lifted. And up until now, we haven't had those, kind of dates. So I think that has been properly tackled. I think we're quite confident.
That is good news. Thank you very much.
Thank you.
Thank you.
Thank you, Doc.
Thank you so much, Dr. Koliwe, for the question. So I will just ask Ineza Kelvin to unmute and ask his question before we read one more question from the chat.
Good evening. Are you hearing me?
Yes, we can hear you.
So first of all, I'd like to thank the panelists for their insight presentation. It shed more light on the critical issue of One Health. But I have one question. As you know, mostly in Africa, there is a problem of shortage of resources. So I wanted to ask how the equitability of resource allocation across human, animal, and environment is set so that the one part doesn't miss their resources, and mostly that there is the balance in the resource sharing of those part, human, animal, and environment, without compromising one unity, and making sure that as human, as we are the priority, like we get what we want. Thank you.
Thank you so much, Kevin. Yes, Dr. Njunga.
Yeah, thank you. Maybe I can start responding. Then Dr. Fausta, can also come in. Yeah, the issue resource under African setting, maybe there are very few countries that a resource issue may not be, a big problem. But in most of the countries, I'll give an example. Malawi, my country, resources are a big problem. And what you have said was actually one of our challenges, right? To come up with adequate resource so that we are able, to do the outbreak investigation. Okay. Now, specifically for this anthrax one, most of the resources, like the hiring of the helicopter, it actually was supported by the African parks, right? And those people, they are pretty well resourced. And since they are managing the Rwanda National Park, it was also in their best interest that they should put in as much effort as possible. But otherwise, resource is a problem. And it's not only a resource as far as One Health, is concerned. Even the governance structure, it's another problem, right? Because without a proper, governance structure and with a very strong political will, it's a nightmare to implement, One Health, because you are bringing in actors from different sectors, right? And the different sectors also bring in different problems. So to get them, well coordinated, it means a lot of resource has to go in. So in short, I can say that resources, they are indeed limiting, and it remains a challenge for some time in most of the African countries. I don't know, probably my colleague may wish to add to that. Thank you.
Yeah, thank you, Dr. Njunga. What I can add, indeed, resources is a problem in One Health, because collaboration is not easy. So when there's a collaboration, there's this part that we say, no, maybe I'm not interested, maybe not. So the problem, the solution would be to advocate for funding streams at national level. Like, let's say if there is a maybe there is a financial year in Rwanda, for example, there is when they budget, they also budget for One Health. But the problem is we like to learn the hard way. We learn when there are issues. Now I know that when they say One Health, because we have had COVID, people know what might happen if we don't put One Health as a priority. So, but now because COVID now is going away, somehow away from us, we're going to start to forget. So I think it's important that the One Health of workforces continue advocating to really having a budget at national level. I'm saying national level because there are different projects coming in from different areas, but usually the projects they have their own agendas. So, but I think if you want to address something at national level, it has to be a national issue, and the budget has to be allocated nationally, maybe supported, but nationally you should look into that. Yeah.
Thank you so much, Dr. Fausta. Now, Robert, can you please read some questions from the chat?
Yes, Dr. Sela. So in the chat section, it has been very interactive. Some questions were answered by the audience, but there's one question of Idim from Nigeria, I think. He asked, is it safe to eat the meat of stranded marine mammals, example whales? I've been wondering what possible zoonotic risks could come to Nigerians who delight in butchering stranded and at times rotting whales and consuming them as wild or bushmeat. Yeah.
Thank you so much. Dr. Fausta, would you like to get that one?
I don't know. I don't know the zoonotic risks that can come from those animals. However, maybe I know maybe one health issue that can come from those, because if they are close to an agricultural field, may have maybe leaching from the agrochemicals, pesticide, and maybe herbicides. If those chemicals have been there where they are, those can be an issue. But in terms of zoonotic diseases, yeah, I don't know. Maybe that's a good question. I also need to learn.
Yeah.
Yeah. Yeah, that's a tricky one too, because even me, I don't have much information about marine animals. And more importantly, zoonotic from marine animals, I do not have much information. But maybe I can speculate about salmonella and some other, bacterial infections, which can cut across from animals, to humans. But I'm not really sure. Thank you.
So,
Thank you
excuse
so
me,
much.
Stella.
Yes,
So,
please.
maybe since can I also ask a question? I had a question to Dr. Njunga about he talked about security issues by like how the anthrax spores are used as a bioweapon, and he was mentioning that he was saying that there was a high security when they were investigating the outbreak. I'm very curious to know if that security is still enforced, because I'm guessing that the spores, I don't know if the spores have finished, because how can you know if there is no spore anymore? And of course I understand the difficulties of it, but I'm very curious to know the security issue around the outbreak area.
Very, very, very good question.
Yes.
Again, to respond to that, there was very tight security when we had that active outbreak, because we had the police and the military on site until the outbreak was lifted. But thereafter, we relied now on the park security itself and public awareness around the communities. But what gives us more confidence, as I said, that the park is wire fenced and it's electric fenced, so it's pretty difficult for somebody to access. But we were more cautious when we had that active outbreak. As you know, that we cannot keep, the police officers and the military people on site for a very long time. One, we are talking about the issue of resource, which is very, very limiting. We cannot manage, to do that. Yeah. So, in short, we had the, visible security on site during the outbreak, but after that, we relied on public awareness and also the physical barrier, which is electric wire fenced around the park. So we assume that things are okay, but good enough. Since then up to now, it's close to 4 years. We have never had any problem, neither in domestic animals, in humans, or new hippos that are getting infected. So at least we have got that hidden confidence that the security issues are at hand. Thank you. But the spores, obviously, they have not all been disseminated. They are there. That's for sure. Thank you.
Interesting questions coming in. Yeah. Thank you so much, Dr. Fausta, for that question. And Dr. Njunga for the answer. Robert, what's happening in the chat?
So in the chat section, there in the audience, we have many experts as well, but one question from Liz Komen. She asked, what about non-viral zoonosis like intestinal worms as a serious One Health issue? She wants to know something about non-viral zoonosis like intestinal worms.
Maybe I can,
Yes.
if I got her correctly, she's concerned about non-viral zoonosis, right?
Yes.
And particularly the intestinal worms. All right.
Yes.
Now,
yes.
what comes to mind? I'm thinking about the roundworms, maybe. Okay. So in that case, these roundworms or these worms in the intestine, they lay eggs. Okay. So once the eggs are laid, obviously they come out through, through feces. So when it comes to, proper, disposal of waste, remember I talked about, waste disposal as an issue regarding, spread of zoonosis. Probably that could be one of the things. And again, I talked about zoonosis not only from animals to humans, but also from, humans to animals. I'll give an example of, porcine cysticercosis, which is a tinea sorium. The life cycle, it involves a human being defecating, anyhow, without either using either in urinary areas using a pit latrine or dispose or wash out toilets. So if somebody defecates in the environment, maybe a pig will be exposed to that, it feeds that stuff. Then we are just secreting the roundworms from the animal to human and back to human. So without proper disposal of fecal material, that can lead to that. I don't know whether I got her question correctly, but she's right that when you talk about zoonosis, it's not only the viral ones. No, they could be viral, bacterial, parasitic. All those are zoonosis. The bottom line is diseases that come from animals to humans and from humans, back to animals. Thank you.
Yes. Yeah, maybe what I can add is that Dr. Njunga, thank you, but he also kept bringing back the trichinella. Trichinella is also one of those. You can also have toxoplasmosis caused by a protozoan. So it's not, of course, when you talk about zoonotic diseases, we look at those big ones that have a high mortality and high fatality rate, but you have those ones as well, the parasitic ones, even the bacterial ones. Yeah.
Yeah,
Thank you
bacteria
so
like the
much.
common tuberculosis.
Yeah. Okay, thank you so much. I should ask Jasper to unmute and ask his question.
How's it, guys? Yeah, I had asked a question in the chat which someone had answered, but I'm not too sure. So basically, if I can, I'd always heard that burning was the correct term, and I know that the doctor did say that digging a pit and putting lime over it is what he would recommend. I was just wanting to understand, is burning actually effective, or is it actually spreading it, and does it make it worse? Because I seem to recall in the let's say olden days or in the past, that was the means, and then did they discover that it actually made it worse? And then just to understand how long, once you've put lime on the carcass and whatever, does it take for it to no longer be contagious, or the spores to be active?
Thank you. That's a very, very good question. To start with, as you rightly say, in the past, they believe by burning the carcasses, then the spores will be killed. But unfortunately, it's not like that. Actually, the burning will expose the virus, the bacteria even further. One,
Oh, wow.
when you burn the carcass, there is that, in most cases, carcasses, because they're intact. So when you're burning them, at some point, they tend to explode or they tend to open. So that opening alone will, spread the bacteria further. That's the most dangerous part. Yes. And now when it comes to once you bury the carcasses and you put quicklime, the question is how long does it take to get it, deactivated? I don't have the exact, number of days that it takes, but what is recommended, or what I would recommend, is that, once you dig that pot, put as much lime as possible. And once you do that, you bury the pit with lime. So the lime and the spores, they will be together forever. So that way you are assured of that you do get, deactivated. But maybe from literature, we can get more information, which I don't have, off head as of now. Thank you.
Thank you, Dr. Njunga.
I just want to end by saying, if I had maybe magic, or if I was to make a wish, I would wish the knowledge of zoonotic diseases can go viral, can be known by everyone, like the way people know that before eating, we need to wash hands. Yeah, so maybe I should ask the audience, please help me make my wish come true by making zoonotic diseases a topic of a conversation. You meet someone, you chat about them, talk something about zoonotic diseases. Thank you so much to our audience. You have been good audiences, asking questions, making the discussion very interactive. We really appreciate, and have a good night.
Thank you
Thank
so
you
much,
so much.
Salah, and thank
Good
you,
night to you
everyone.
too. Thank you.
Bye.
Bye.